Meeting of the day. This is it's quite a lengthy meeting, but I'll try not to hold you up too long. I would ask if any member has a declaration of pecuniary interest, they declare it now or at the appropriate time. Seeing none, we'll move on to action items, and there is only one. The analysis of the call volume. Charlie?
Thank you, Mr. Chair, and in that I have Chief Ray Lux here today, who actually prepared and will present the report today, please.
Welcome, Ray.
Okay, thank you, everybody. So this report, it's the last one of the day. It's a long report. I'll try not to read through it word for word and highlight the main points and go through the data as easily as I can. And I know it's been a long time coming. I appreciate you the time. It took a lot to get through a lot of this data and try and analyze it fairly well for you. So the recommendation is that you receive this report and that consider for the 2018 budget, we upstaff Chesley Station for nights rather than the current Friday, Saturday nights only that we staff with part-timers. This entire report has an analysis of call volume data and response time data for Bruce County Paramedic Services over the last 10 years. And we got it all from the ambulance dispatch reporting system, which again explains why maybe it took so long to analyze some of this data. It's a difficult system to try and get it and then put it in a meaningful way. And then CTAS data is what we have been reporting on that for the last few years, which is the way the ministry does report some of the response time data. A little bit harder to track. We have to do that through our ambulance call reporting system, and that only goes back until 2011 because that's when that system was kind of implemented. So terms in there I can explain as we go through. You've seen a lot of these terms before, but just so they're in the report, what code 3, code 4, CTAS means. So Stats Canada census data shows Bruce County has had a population increase since 2011 of 3.1%. Since 2006, it was about 4.2%. We've had a lot of pressures ongoing, including increased population. There's more tourism, as you know, and an aging population. We're still waiting for some of the census data to be analyzed a little bit more as far as what the aging statistics were, but the last time around, Bruce County was higher than the average provincial average for residents over age 65. We do have an older population in Bruce County, and almost double what the provincial average is in the North Bruce Peninsula area. So they've been challenging to our paramedic system to meet response time criteria and the overall demands to have a timely and effective ambulance service. We've done our best to work with non-emergency transfers, reducing those as much as possible by working with the local hospitals. We've really encouraged them to use other transfer means such as non-emergency transfer services. But there are more patients requiring higher interventional diagnostic testing. There's younger doctors. They basically want CT scans and other diagnostic tests to be done in a timely manner, and calling these urgent transfers because they really need these done before they can make a diagnosis of patients. So that does put an impact on the calls because we're still required to do those ones as well. And some of the regionalization of medical facilities. Stroke care typically will bypass a local hospital to go directly to Owen Sound or Goderich if they meet specific criteria, so they're brought directly to specialized centers, and there's more of that happening as well, which increases our transport times and the amount of time that a local ambulance is kind of tied up for a call. So in the data, you'll see through there, if you've reviewed it already, call volumes have been increasing. Our response times have increased more in some areas than others. We are geographically spread out. Sometimes there's multiple calls in one area, and during those busy times, they're going to increase our response times. They've been minimal to date, but we're going to get to a breaking point with the number of calls that they keep increasing and trying to have timely service. So, going through the data year over year, there's been a trending increase in the call volume. Just overall in the county, if I skip up a little bit here to the pages. So overall in the county, I apologize for this, I should have the county one first. I did them by the municipalities. Overall in the county, we've increased calls 48% since 2007. Year over year, there's been increases 2 to some years 10, 13%, and some years down. It's going to be variable, but since 2007, our code 3 and 4 calls have gone up 48% since 2007. So kind of trending that ahead, if we were to look at 2017, 2018, if we stay on the same sort of curve, call volume is going to continue increasing. Breaking it down by the Peninsula Hub, I'll go back here, but they have increased a little bit less, 38%. Sorry, let me get to their chart. Here we go. Peninsula Hub, yeah, sorry, has gone up 38%. And in all the data there shows each of the lower tier or your lower municipalities, and we've broken down into the hub. So again, trending year over year, it varies 2 to 5%. One year was 2014 seemed a big year everywhere in the county, jumped higher there, but they have gone up. For the interior hub has also gone up 53%. Interior hub's gone up 53% since 2007, and then the Lakeshore hub again. Has gone up 52%. So, and again, similar increases up and down, varies a little bit year over year, but on average moving up. So again, that same sort of trend line, they are going up year over year. From this, we also looked at sort of the quarterly data as well. It makes sense that Q3, the July till September are the busiest times. We do have a bigger population with tourism as well. Q1 and Q4 are the least busy. Q2 seems to pick up a little bit. For the interior hub, it was interesting. Call volumes remain more consistent through each quarter there. They don't quite change as much as they do in the Lakeshore and Peninsula, but again, with tourism, that sort of does make sense as well. More people are going to the Lakeshore areas, and Sauble Beach, Wyerton, and Tobermory, all the way up there. We have the more tourism influx, so it is busier during Q3. By station, our code 3 calls and code 4 calls have increased. Walkerton's gone up 52% and 37% respectively. Chesley's has probably gone up the most. Code 3 calls 83%, code 4 calls 93%. Kincardine, the one that I wanted to highlight here was that our code 3 calls have increased 139% and code 4 calls 25%. I really think a lot of this is part of Kincardine Hospital. Being where they are and some of the services they need, they send a lot of patients out for CT transfers, and they don't always want to call them non-emergency transfers. So we are trying to work with them and trying to make sure that they truly are stat transfers if they are using us for these. But I think a lot of that increase is because of some of those CT transfers that, again, it's something else we need to work with that hospital specifically. And similar across the other stations, they have all gone up 42%, 40% for Port Elgin, Wyerton up 40%, and code 4 calls 27%, and Tobermory not as big of increases, 19% for code 3 calls, and code 4 31%. Let me go back to the report here, just so you know where I still am. You're not asleep yet, so that's good. Using our response times now, instead of looking at just the call volume data, there has been an increase in response times. Going back, we looked at it a couple different ways. As I mentioned, the CTAS response time is a little, and I'll get to that, is a little bit more variable, harder to actually pinpoint different changes. Using the way that was done in the past, when the service was taken over, and for many years, the province measured it on a 90th percentile. So taking all the calls that we do, 90% of those will be done in a certain time frame, and only 10% of the calls don't meet that time frame. It was kind of a standard way of measuring those things. Up until about 2003 or 4, I believe. No, it was later than that. Sorry, it would have been 2007 or 8. We basically measured it from the 1996 standard. So for Bruce County, we were to meet a 19-minute and 56 90th percentile response time. Very difficult to meet. They just looked at 1996 data and said, that's what you are, so they just continued to measure it off of that number. It didn't really necessarily make sense, so they have changed things. But looking at where we are right now, if we were to use the 90th percentile, Across the county, it has increased 1 minute and 30 seconds, so now we're at about a 22 minute and 9 second 90th percentile time, versus in 2007 was 20 minutes and 39 seconds. The Peninsula Hub, up 1 minute and 7 seconds. The Interior Hub is up 2 minutes and 8 seconds. Interestingly, the Lakeshore Hub, though, only increased about 15 seconds. A little bit hard to pinpoint some of the reasons, but considering what our deployment plan is, typically what happens when calls happen in the Lakeshore Hub for Kincardine and Port Elgin, we'll move either Walkerton or Chesley to the Lakeshore area when they get a call to cover off that area. So therefore, they're getting moved further to the west, and we rely on basically Grey County and Hanover covering off those areas. If Grey County wasn't available, Walkerton would only move over to Kinloss, so we're kind of in between, but we're still a little bit closer maybe to some of the Lakeshore areas. So it almost makes sense why the Interior Hub response times are increased by 2 minutes, whereas the Lakeshore is only increased by 15 seconds, because I think by deployment, we're moving vehicles over when calls are happening, so they're still getting a fairly good response. Looking at the time patterns, calls are busier a little bit during the day, less so at night. We don't have coverage in the Chesterley area from Sunday to Thursday night, so that can also account maybe for some of the slower response in the Interior Hub. Another way we looked at response time is just taking the average amount of time it takes to get to a call. So for code 3 and 4 calls, it has increased, not as significantly, but on average we will get to all calls, our code 3 and 4 calls, 10 minutes and 40 seconds in 2016, and it was 10 minutes 17 seconds in 2007. Peninsula Hub increased a little bit more. It was 1 minute and 8 seconds. Again, Interior Hub didn't increase a whole lot, nor did the Lakeshore Hub for average calls. Again, it comes down to the long distance in the Wyert and Tobermory areas, I think, to have that longer response time. There's just the two sort of stations in those areas, longer response time to get there, so it can cause that increased average response time for the peninsula. Looking at it again by quarter, there was an increase in the response times in Q1. Typically, I would say due to the weather conditions, it really was variable each year. If we had a good winter, sometimes those times didn't go up as much. Bad winters took a little bit longer. Q2 is probably kind of a standard response time. It's not too bad. Q3 goes up again, but again, that's probably due to call volumes. But trending over 10 years, it's typically there's an increase in our average response times, except for Q1 was just so variable. And so getting to the CTAS, which is the way we sort of measure our response time now, looking at it from 2011 to 2016, our targets are continually close to being met. The main ones I pinpointed were CTAS 2 and 3, which are kind of the most urgent ones. Some of them are like, basically correlate with those code 3 and code 4 calls. We didn't include the CTAS sudden cardiac arrest, SCA, or CTAS 1. Those call volumes are a little bit lower, and those times are basically dictated by the province. They set them at 6 and 8 minutes. We can say the percentage of the times we get there, so we really are setting it as to what we think is going to work. So we're kind of dictating our own response times for these, and trying to say when we can make them. But standardizing it off the 2015 plan that we were using, they have gone up a little bit, especially in Q3. It's a little bit more for the Peninsula Hub, and it's always been challenging there to actually meet our response times, but it was a little bit lower in Q3 for the Peninsula Hub. In the Interior and Lakeshore Hubs, again, Q3 is a little bit slower, but we do meet our response times in those areas when we are doing them. Looking at it by time of day, again, call volumes have increased. They did actually decrease. So for these ones, we looked at all of the calls, code 1, 2, 3, 4, and 8, because it's showing when all vehicles are moving. Code 1 and 2 calls have gone down. In the county, we're doing just a couple of hundred of these in a year, so it didn't really change too much by including them. Code 8s are our standby calls. So if a vehicle in one area is doing a call, another vehicle is moved to cover off that area, so we do have to have that movement. So looking at that, and when the calls come in, during the days, they've actually decreased a bit, and I really attribute a lot of that to not doing some of these interfacility transfers. We've decreased a lot of those calls in the last few years, so we're not doing those calls, as many calls during the days, but they are increasing during the evening and overnight hours. These are seeing basically the same increases at each station. When you compare them, each one, they're all doing the same basic increases and decreases during the day. The day of the week really doesn't change the call volumes. So Saturdays and Sundays, we're actually down. We don't have extra vehicles, and that's where I'm getting into our current changes here. We have the 24-hour vehicles in Walkerton, Kincardine, Port Elgin, Wyerton, and Tobermory. If you look at the number of calls that Tobermory does and then look at the number of calls that Chesley does, Tobermory does probably less than half of the calls that Chesley is doing, and Chesley's only staffed on nights on 2 nights a week. So just another point just to keep in mind. But we do have the 12-hour day in Chesley, nights just Friday, Saturday. We have 3 9-hour vehicles. 2 of them are staffed right now from 8 to 5, Monday to Friday in Walkerton and Wyerton. And then there's another one which we had changed a couple of years ago from 2 till 11 o'clock in Port Elgin from Sunday to Thursday. We really looked at these hours to try and see what we can do for this summer to try and better utilize these vehicles. If we don't have as many calls going on during the days, but we have more in the later hours. We're going to move the Port Elgin vehicle to Monday to Friday from 1 till 10. The Chesley night vehicle then will be Saturday and Sunday nights. And the bigger impact will be we're going to move the 9-hour vehicles, change them into a 12-hour rotation. So rather than having 2 of them on Monday to Friday, there will only be 1 on, but it'll go right through Saturdays and Sundays as well. So they're going to be longer hours of coverage Monday to Friday or Monday to Sunday. And we will have an extra weekend vehicle on, which will help cover off some of those busy weekends, especially in the summer when we don't have those extra vehicles on to help cover off certain areas. They're still going to work out of their home station to help minimize that impact on staff because it is a big change to kind of their lifestyle and where they're normally reporting to work. But based on what the supervisor and dispatch decides how busy they are during that day, that vehicle will get deployed where it needs to be for the busiest time. So that doesn't necessarily mean that they're going to be constantly working out of Walkerton, and doesn't mean they're just going to work out of Wyerton. They'll get moved to where they need to be for where the calls are for those times. So we'll have that extra coverage Saturday and Sundays. It wasn't there. But basically, I've gone through all of that. What I'm also asking is that we really consider upstaffing Chesley to 24/7 coverage in 2018. It's not uncommon that we're at reduced coverage on nights based on we're using, it's kind of, dispatch is able to track when we get down to 3 vehicles or less in the county, and they're sending these back to us. So that just started last September. October was sort of trial. November is getting a little bit more accurate for the data they have. So we don't have a lot. But for the number of times that it has happened, 69% of them are happening on night, and it's not on the 83% of those are when we aren't staffed Chesley nights. So the reason I'm saying Chesley isn't necessarily because Chesley needs that coverage. Typically Chesley is a vehicle that does get moved around because they're central to the county. They will go to Port Elgin, they'll go to Wyerton, they'll come down to Walkerton, over to Kincardine, based on how busy things are. It'll be that extra vehicle on nights to help cover off, to help the response times and where we need to have them. So we're going to continually track these, and with the changes we're doing now, I'm not really necessarily recommending that we do anything for extra summer coverage until we see if our changes with changing those 9-hour vehicles to a day vehicle, if they help this summer and next summer, and then we'll go from there whether we need to look at maybe a further upstaff for summer coverage depending on how busy more tourism keeps happening. But the financial considerations for what I'm asking for next year would be wages and benefits for staffing to cover the additional 5 nights a week in Chesley. Currently, we're staffed 2 nights a week. It's by part-time staff, and it's basically 48 hours per week. I should have added that in the report, that those are 48 weekly staffing hours, not yearly. And an increase of 120 weekly staffing hours would be the increase to actually accomplish this. So I will open it up to some questions if
Thanks very
that's
much,
a lot
Ray.
of
That's
info. Yeah.
good information, a good report. Questions for Ray? Robert?
Do you find that the public is finding out that the paramedics have more medical knowledge, more equipment within the ambulance to deal with them? So you get more calls where people would just go to emergency at the hospital. Are you getting more calls from people that could maybe be doing that, but since they're getting familiar with the ambulance services, that they're phoning you instead?
That could be part of it. And honestly, to figure out why we're increasing, other than the population demands and the aging population, whether it is the knowledge and they know that we are able to do more. It's hard to say. I did go through, and I didn't do it for all the 10 years because it was very difficult to pull out. I can't attribute all of this increase just to hospital transfers and things like that either. If you actually pull out the code 1 and 2, which are very minimal, and then the actual hospital transfers out of the data and then still look at it, there's still an increase in the number of times we're getting called. It's not that it's because we've decreased non-urgent transfers that we've just automatically transferred all of those into emergency transfers. It pulls that out. So people are calling us more, but yeah, I don't have a great answer for you on that as to why.
Mike?
Thanks, Mr. Chair. I think probably the big reason is your calls are going up, so that'll be why you're getting more calls, and your response times will follow that, because you're shifting resources around, right?
Yeah.
I think I think what your suggestion is probably a great idea. I think when it tells you in the long term that we're going to continue to add resources to this service.
Yeah, eventually it's going to plateau. I think we're doing a lot with the resources we have, and we're able to maintain what we're doing. But if call volume keeps going up, eventually it's going to be a little bit more difficult. We're not like the city services, so we don't do maybe as many calls during the days, but when we do get the busy times, it's hard to do because we're so far away from other areas.
The other thing I raised, I know that I seen it where Grey County was picked for that EPIC program, and now that apparently I guess they're going to be funded permanently on that, delivering that program.
Yes.
Yeah, and I think the objective of that was to hope better health service, but to try and reduce calls to your service.
Yes, and I believe they haven't released actual study results yet for it, but I think seeing that the LHIN has agreed to do this and that they're going to fund them for it, there must be some results maybe they have already that it is working in areas. There were only a couple areas that started with a full EPIC program. It was a trial basis based on some initial funding. Grey County and York Region were two of the big areas that actually did that sort of stuff. My understanding for the funding for that right now is the LHIN got the funding to continue on what was already going there, and there's no additional funding what they have. I'm not saying we can maybe work towards something like that and start petitioning the LHIN to up staff or look at these sort of options, but it's costly because you've probably heard how much it costs Grey County to run this program, and we would have to start by training medics as well, sending them away for specialized training, and then you're having them off the vehicles. And it's not funding, my understanding, this funding is directly from the LHIN to continue that program, so if it doesn't come from them, then it's not funded by the municipality, and it's not the typical 50-50 funding that comes from the province for running the ambulance service. This is a separate entity on its own. Mm-hmm.
Good report. And just with the way Bruce County is growing, I think we're looking at 400 to 500 new homes being built this year in Bruce County, probably for the next 5, maybe 10 years. Mm-hmm. There goes population growth. But the traffic on Highway 21 and 86, what I notice, which is in my backyard, is going up substantially, and there's just more traffic, more people passing where they shouldn't. It just all adds up, and this up in Highway 6 and all that too. Mm-hmm. So good report. I think this is the telltale that what we're facing over the next couple of years is we're going to need more staff and probably more vehicles.
Mm-hmm.
Okay, nope.
Ever at a critical point for vehicles,
There are times, what we do with the dispatch, there's a term out there and it's getting around a little bit. The dispatchers know when we're down to 3 vehicles or less, and they're calling that for us a code critical. And that's a term that we've said when we get to 3 vehicles or less, we want to be notified that that's all we have in the county to cover off. So our deployment plan, when that happens, obviously on nights, if there's Chesley is staffed, we have 6 vehicles. And if it's not, then we have 5 vehicles in the county. So it only takes 2 vehicles to be doing a call on to be down to that level. And then we move vehicles basically in Mar, Burgoyne, and Kinloss to try and cover the entire county if another call was to come in. And during some of those times, we may actually go down to 2 vehicles. And now they do last sometimes only for 30 minutes. Sometimes they're lasting for 2 or 3 hours because vehicles, we've got 1 or 2 that are actually going down to London with a critical patient or something that needs to be out of the area. So we do rely on other areas. And Grey County is no different. They have some of these same challenges. We cover off them when they get down to low coverage, and they cover us when we get down to low coverage. But
I was going to ask.
So that's this term that is coming out. We've never been down to one what we call a code 0, where we actually have no vehicles in the county. I think for a very small time last summer, we were down to one vehicle in the county that lasted, it didn't last very long.
But we pull from Gray
Yes.
Resources, or if we have to, or Huron.
Yes,
Yeah.
yeah.
So then that's.
The
that's
dispatch
under-
will
that's-
always send the closest vehicle to code
Yeah.
3 and code 4 calls, so even if it happens to be in Bruce County and Gray County is coming in, the one difference between Gray and Bruce and then Bruce and Huron, between Gray and Bruce, we've worked it out enough, and Doug had brought a report a couple of years ago now that the number of times we cover them off versus the number of times they cover us off, the cross-border billing issue there really wasn't worth trying to fight out the dollars and cents back and forth each year. We still do have a cross-border billing agreement with Huron County for the number of times that they're coming into the Lucknow area once in a while, and that comes to a tune of about $65,000 a year, I believe, that we're paying them to do some of those calls as well. It's not, at some point, do we look at how high does that get? To staffing a vehicle in that area is very expensive too. Like, right now, I think we're still better off just doing what we're doing, but at some point, as you're saying, 86 and Highway 21 are getting busier too, so.
Ray, are we seeing any increase in volume calls as a result of drug overdose?
We've worked on with that drug, forgive me, I don't remember the name of it's the task force that is out there looking at some of it. We haven't had a huge increase and a lot of calls. There have been 2 or 3 that I know of where we've actually used the Narcan that is out there, so it's a little bit more than, well, we haven't had it for a long time, but it is being used to help with patients when needed. And there's, so it is happening, but I honestly can't say there's been a huge increase in the area. There's a new public site that we were just alerted to that is tracking through the hospitals the number of times that people are coming in with overdoses and whether they're admitted, whether they actually die, whether they're treated and released sort of thing, and that's something we'll keep an eye on too. So not all these patients are coming in by us sometimes either because they don't necessarily, they don't always want to call us because they think they're going to get in trouble because then maybe the police will come too. So sometimes they make their own way to hospitals. So it's, yeah.
Okay, there's a recommendation before us that the report on call volume and response time analysis be received, and that for the 2018 budget, Chesley Station be staffed each night rather than the current Friday, Saturday nights only. Further discussion? All in favor? Mover and a second, sorry. Mitch? And, no? All those in favor? Opposed? Carried. Thank you.
Thank you. Yes.
One more question.
I just have a question, and I have to relay it to you, Ray. It's just from our residents, and I know the call volumes are low in Tobermory, but it's the response times that they have a concern about, and I just leave it with you. And, yeah, I don't know what can be done, but
Yeah.
it's just something to think about.
It's as I said, that's a difficult area. We've got probably the most northerly point. If it happens right there and the crew is there, but when we bring that vehicle down
Yeah.
to cover off because Wyerton's getting busy, then it's either a long response backup or
Yes.
if it's happening in Lion's Head, either
Yes.
way is a long response
I know,
time.
I know. So, as I said, it's brought to me, so I'm just letting.
Yeah.
Yeah.
Kelly, did you have something?
Through you, Mr. Chair, it is entirely unrelated to paramedic services, but I just received an email and I thought it would be important that all of you hear it first, that Bruce County has won an International Communications Award for our work with the Bruce brand. And that we heard last night, and it's quite exciting. So I'll be sure to send some pictures around, but it's a really big deal. It's nice that Tenzing have also been recognized through it, so. Yeah.
You're okay with that? Yeah. Okay. Well, that's good. Good news. Okay, I need a motion to adjourn. Mike and Robert, and we meet again on July the 6th.
That's in here, Ken Loss, and